Hi, I'm Dr. Adrian Fenderson from the All About Smiles Dental Office in Napa, California. I'm going to visit with you about a question I get from my patients all the time. How come I get more cavities or less cavities than my brother or sister or friends? What is the cause of cavities? Is it all just sugar and diet? We're going to talk about the different factors that come in to cause of decay. One of the factors is, of course, hereditary. So you think of a little circle of hereditary. Think of that. That's part of it. How hard are your teeth? How much resistant? How packed is the enamel? The second thing is what you grew up with. Did you grow up in a place that had fluoride? So that is the formation of the tooth. So think of the formation of the tooth and hereditary. And put that circle right over that other circle next to it, like you might see in the rings of Olympic rings. Another circle is diet. So you put that circle around there. And what you eat. How you eat? Do you eat a lot of acids? Do you foods like lemonades and pops? And is there a lot of sugar in your diet, especially in between the meal? Do you have sugar feeding the bacteria all day? Then another little circle in there is the type of bacteria you have in your mouth. Some people have a bacteria that forms decay easier, forms more acid, a lactobacilli, and the type of bacteria. And there's actually chemicals now, and actually candy that you can suck on to lower that type of bacteria, to reduce that. And then, of course, then the last factor besides your family and what you eat and your genetics of or the type of bacteria that form in there is how well you take care of them. So put all those circles together, and if you happen to have poor genetics and a diet that's terrible, and you have the type of bacteria that form decay easy, and you don't clean very well, and maybe I said you eat poorly, you put those all together, and that center where they all crisscross is big, you'll have a higher chance of getting more cavities. Some of the things you can control, and some of the things you can't. You can control the bacteria, you can control what you eat, and you can control how well you clean, and that's what your dentist will teach you. Those three aspects, at least things that you can control, and they're even working where they can control the type of bacteria that are growing up that you've been inoculated with from your parents or from relatives or people around you that have set up housekeeping, you might say, in your mouth. Well, I hope you have a better understanding of why some people get more decay than others.